Hi, we're going to do a video today of a patient who in September of 2017 had a very large stroke on the right side of his brain. He came into the hospital initially just feeling as if he had some tingling and weakness on the right side, and then it progressed to the point where he needed a craniotomy and had to have blood product removed from his brain. He couldn't speak, he couldn't walk. Right now him and his wife are with me today, and they're very frustrated that they feel that other people don't understand why he's not getting up and going. So one of the things we're doing today is showing a video of the damage in the right side of his brain. He even lost a complete visual field on the left side, which is now completely resolved, and he can now see quite well on the left side, even without what they call scanning. Some people that lose the visual field on the left side, they have to turn the head to the left to see, but he can actually see on the left. So let's start off with a little bit of a video showing you what his brain looked like. This is a video of Steve's brain, and Steve's with me during this, and he's agreed to the YouTube video. We'll talk to him in a minute. Just for orientation, here's Steve's eyeballs, here's his nose, and this is the right side of his brain. This is fairly normal looking. This is on the base of the brain. Now we'll start off with the MRI on the top of his head. What we've done here, we've taken a slice of the top of the head and we're looking down on the brain. So that looks pretty good. But as we start to go down, just a little bit down from the top of his head, we can see these white areas. This is like in the posterior or the back part of his brain. We keep on going down. We see a big area of white area. See, this looks normal here. And there's a big vacuole. There's like an absence of brain material here. And this is ischemic and dead and sclerotic brain or scar tissue brain. We go down a little bit more. We still see the back of the brain getting towards the visual cortex has a lot of this sclerosis part of the brain where it's scar tissue, and then a piece of the brain that's missing. And you compare over here where the brain gyri, normal brain tissue, kind of looks like a cauliflower. We'll go a little bit further down. Large part of the brain, visual cortex, a lot of sclerosis, big hole in the middle where he had hemorrhage that was eventually removed from the brain. Again, going further down, we see a little sclerosis now in the frontal part of the brain. Scar tissue, little white scar tissue here, big hole in the visual cortex of the brain. So it's not just the occipital, but it's also the side part of the brain, the parietal part of the brain. Again, going further down, more scar tissue, hole in the brain. Further down, starting to get a little bit smaller. You can see the scar tissue with where the brain was removed. Now we're seeing ventricles. This is where fluid is in the brain. The ventricle on this left side looks okay, but this side's kind of small. A lot of scar tissue around here. Going down, look, there's scar tissue that's even coming up to the front of the brain. The front of the brain has to do with executive functions. On the parietal side now is also problematic. And there's an asymmetry or a much larger ventricle on the right side than it should be. And the left side is smaller because the cerebral spinal fluid is not being symmetrically distributed. Very small on this side, very large on this side of the cerebral spinal fluid. Scar tissue, a little bit of edema in the front of his brain too. Scar tissue, some edema, pushing of the brain over from the right side over towards the left because the ventricle, or this dark part, which should be fluid, is now being compressed. More scar tissue now in the front part of the brain. Scar tissue around down here, a large ventricle. Scar tissue even in the middle part of the brain. You can see it's not quite the same. And now it's starting to look symmetrical, a little bit of damage down here. So let's just get another quick look at this in a quick view. Compare the right side to the left side. Left side looks good, big hole, a lot of visual cortex, about a quarter, really half of the whole right side of the brain. Half of the whole right side of the brain's been infarcted with loss of tissue. Again, about half of the right side of the brain. Still problematic. Problematic, even starting to go towards the front of the brain, going towards the front of the brain, pushing from the right to the left side. And we can see more frontal stuff. Quite a big difference. Now we're going to talk to Steve. Hi, Steve. Thanks for coming in today with your wife. So you don't mind doing a YouTube video with us today?
No, not at all.
Good, I really appreciate that. So we just saw an MRI of your brain, and I know there's been a lot of frustration with you and your wife, but even more with friends. What's some of that frustration? Can you tell us?
Oh, just the, just people not understanding how, it seems to have taken forever for us to be showing positive signs and on turning around, on getting back to normal and life getting back to normal as such. Obviously our whole life has changed. It's a complete life-changing thing, and one of the most common things, of course, is that strokes and things only happen to old people.
But you're not an old person. You're 52, and you had your stroke.
Right. That's right. So,
but you had diabetes and blood pressure.
Yeah, it was a complete shambles.
Drank a little bit too much alcohol.
Yeah.
Now I hear you don't drink any alcohol.
No.
Diabetes under control, blood pressure's under control.
Yeah.
And you've lost a lot of weight too.
Lost a lot of weight. It's been a life-changing thing, that's for sure. But it was something that had to happen. But maybe, obviously should have taken a little bit more of a control on it a bit earlier.
Now you said a lot of people don't understand. They say, well, why aren't you doing better? But we saw pictures of your brain, and a quarter to a half of your right side of your brain has been involved.
That's right, yeah.
Now, when you first came to the hospital, not only did you have blood in your brain, but we also had an infection in your brain. You were on antibiotics, which was quite severe. Had to remove the blood, have to give you antibiotics. Matter of fact, your swallowing is so bad. You remember we had a tube put in your stomach.
That's right.
Because you couldn't even swallow.
That's right.
Because when you swallowed anything, even secretions, it would give you a lung infection.
Drowning, yes.
So now you don't have a PEG tube and you're eating, drinking normally.
Yeah.
So you couldn't talk after your stroke. You couldn't walk. You couldn't move your right arm. Couldn't move your right leg. Couldn't understand people. And couldn't even swallow.
That's right. It would have been a little bit like perhaps comparing it with an animal, perhaps like with a veterinary. I couldn't tell anybody what was wrong with me, so it was just a complete guess, and just had to play it by ear, and I truly admire the way that the doctors went about finding it. But it was just such a time consuming thing to get the diagnosis and find out exactly what was the issue. It took a couple of months in all to get to the bottom of it all.
Yeah, but then when it happened, the stroke, it happened suddenly.
Yes, that's
right. And then we acted suddenly.
That's right.
Now, one of the interesting things I think I want to show the audience not only is how you're walking now, where you couldn't walk before. You notice that you're using your arms. Also is the fact that your visual field has improved. You couldn't see the whole left side of your visual field.
That's right.
If something was on your left side, you couldn't see anything. And we saw the stroke part of your brain was in the visual cortex. Let's show the audience real quickly. Do you mind looking at me and cover your right eye for me? Now cover it tight. Good. Now do you see my hand here?
Yes. Yep.
Keep on looking at me. Keep your eye right at my nose. Can you see my hand here?
Yes.
Now, before you had your stroke, when you had your stroke, you couldn't see my hand here.
Right.
It wasn't until my hand got here that you could see it.
That's right.
Can you see my hand here?
Yes.
Is it moving?
Yes.
You see it the whole way?
Yes.
So I think that's an amazing thing that I want the audience to see, that such a large, you can move your hand, such a large damage of your visual cortex, you couldn't see half the world, you now can. Now let's show them you walking a little bit. Is that okay?
Yeah, that's fine.
Okay, I'm going to shut this off. So, Steve, you don't mind us using this on YouTube video, right?
Yep.
And you couldn't walk at all, couldn't talk, couldn't eat, couldn't see the left side. Let's see how you're doing today. Around 2 years after your injury, right?
Yeah, coming up.
Okay, coming up 2 years, so a little less than 2 years.
Yes.
Okay, let's see.
So 17.
Yeah, almost like what? About 20 months or something like that?
Yeah.
Okay, let's see how you've recovered.
Yeah.
Can you just give us a little walk? Let's just walk outside the room and then back again, okay? That's pretty good. How far can you actually walk? About half a block?
Up to 150 meters.
150 meters is pretty good.
Yeah.
Pretty good.
With obviously with the assistance of this
The Hemi walker.
stepper. Yeah.
So just kind of take a turn around and we'll go back. Oh, actually, your wife has your wheelchair behind you if you want. You want to just sit down?
I can turn now.
I think she's trying to trip you up with a wheelchair. Okay, he wants to turn around.
I'll turn, hon.
Okay, I'm just.
She's just being careful.
Yeah.
So even though you can walk 100 meters, you got the health and safety officer, your wife. Well, I appreciate that. We certainly don't want you falling on our video. Have you had any falls in the last few months?
No, none at all.
No falls at all. Well, that's fantastic. Okay, well, why don't we let her put the wheelchair behind you, okay?
Yeah.
And then we'll sit down and end our video. Okay, she's right behind you now. Let's hear, stay like that. Let's see how you sit down. She's helping put on the brakes because she's a really good wife. Okay, thank you very much, guys.